Now, I want to touch on gut dysbiosis. You touch on that quite often. You talk about that. Can you tell us how peptides generally affect our gut microbiome, and maybe specifically GLP-1s, how they balance the gut microbiome and also how they affect it, and where does the gut play in? What role does the gut play in all of this?
Oh man, I don't think
And that was a lot. That was like four questions. Talk about the gut and peptides.
I mean, your gut health is so important to the whole rest of your system because again, your gut is considered your second brain. That's where all the digestion takes place for the assimilation for the rest of the body. So that's where you're going to get the rest of the nutrients. If your gut lining is not healthy and we're getting what's called as like leaky gut, where food particles are passing through that membrane, then the body starts to see those particles as a foreign invader. And then what happens is you get this hyperimmune response. And so then your immune system alarm starts to go off. And then that increases inflammation within the body. And then a whole host of processes within the body start to go off where people get like histamine responses. And the body starts to attack itself because it sees those things as foreign invaders. So like gut health is like number one in terms of preventing a lot of these unnecessary conditions that are taking place. And again, this will lead to, like you said, the gut dysbiosis. And what is gut dysbiosis? Gut dysbiosis is that delicate balance between good and bad bacteria within our system. So we always have a level of, again, quote unquote, bad bacteria. And what happens is that bad bacteria starts to overtake the quote unquote good bacteria within our system, and it creates a disbalance. And we got to understand that these microbes in our system, they release waste products. So if you have more of the bad bacteria, they're releasing waste products within your system, creating a burden over your system, and you're not getting the beneficials from the quote unquote good bacteria, which again leads to more inflammation and chronic disease. So with the peptides, especially the GLPs, again, what that does is that helps calm down that inflammation within the gastrointestinal tract. One, directly, and then also two, indirectly, because it's just being honest, we overeat. And when you overeat, because of the hyperpalatable food within our system, that causes immense distress on your system. And then that leads to more feeding of the bad bacteria to help kind of deal with our just poor habits. So when we add the GLPs and it calms down that food noise and increases satiety, we're not overeating, which is just huge. So then we're not actually feeding that bad bacteria, and we're giving the good bacteria a chance to start to multiply because you're actually starving that bad bacteria and helping to restore the gut. Now, in terms of other advanced peptides we can use to help with that, I mean, BPC is a classic one for gut, KPV, and then LL37. Those ones specifically will target those, quote unquote, again, bad bacteria within your system to, again, bring those more within balance and allow the good bacteria to proliferate within your system and restore that balance.
Thank you for touching on that. Since we're on the topic of the gut and GLP-1s, I want to ask you this question, and I think a lot of people want to know this. There's a lot of famous families and a lot of companies out there advertising nature's Ozempic, these supplement form of GLP-1s that help your body's natural production of GLP. Can you talk to us about these supplements? Are they real? Are they fact? Should we take them to work?
They exist. Do they work? Short answer is no. And I'll explain why they don't work. So yes, your body does have a natural production of GLP within the system. And there's some theories that, are we GLP-1 deficient? Is that why we're having these effects of overweight? So do we need to just take like an oral supplement to increase our own body's natural production of GLP? And like, that sounds great, but what does that actually mean? So yes, your body does produce natural amounts of GLP-1 within the system. The problem is that is broken down by an enzyme called DPP4. And it's actually broken down pretty rapidly, that it only exists within the system for about 2 minutes. And because it only exists within the system for about 2 minutes, only about 10% of that gets into circulation through in your system. And then also too, it doesn't cross the blood-brain barrier like these GLPs do. So with the synthetic forms of the GLPs that we have, whether it's like semaglutide or tirzepatide, the half-life is a lot longer, so it's in your system, so it's not broken down within 10 minutes, so you have that longer-lasting effect of the GLP. Because you have that longer-lasting effect, we get more within circulation. Because we get more in circulation, that's going to cross the blood-brain barrier. And again, why is that important with crossing the blood-brain barrier? Because again, that's going to help down with that food noise. So with taking the supplement, as much as I would love to say like that's real, we can do that, that's going to fix everything, it's not going to cause down the food noise, and it's not going to cause as much as the satiety effect and the appetite suppression, as well as it's not going to have some of these other powerful effects, such as the regeneration of like muscle tissue, cardiovascular tissue, and these strong anti-inflammatory effects on the gut.
So short answer, no, they don't work. Okay, don't waste your money.
Yes.
All right, awesome. Well, thank you. Thank you for